it's a imaginary situation given to us that some clinic has reported that suddenly their pregnancy rate has gone down. So how do we help them? So in order to that, what we have done, we have called a team of experts who have vast experience in IVF and troubleshooting. So, as I mentioned, we are given this job to solve the problem. So the thing is that my experts, the group of experts, they started asking questions to the clinic. So Dr. Charudat Joshi asks this first question: are we talking about BCR, biochemical rates, the implantation rate, the clinical pregnancy rate, or live birth rate? Because they just mentioned that the pregnancy rate is down. So we are not clear. So Dr. Joshi, what does this question mean to you? Why did you ask this question to the clinic?
Yeah, that's a very basic question, which I suppose one should ask. That pregnancy rate means what? Actually it depends on so many factors involved. Pregnancy is not just a process that you have done IVF and you got the result. So there are male factor, female factor, laboratory factor, so many factors are involved. So our question should be like what pregnancy rate has gone down? It's a biochemical pregnancy rate down, which is a good sign that okay, they are not getting biochemical pregnancies. It's implantation rate or cumulative pregnancy rate. What particularly we are interested in live birth rate. So you have to basically first sort it out that what kind of pregnancy rate decline is there. If it is, it may be because of laboratory issues, or it may be so. That gives you an idea that okay, the problem is in biochemical pregnancy rate, so it must be related with some laboratory condition or maybe some cultural conditions. So the total overall implantation rate, or so we can have a basic idea about. And we can always compare it with their previous record, that what previously they were achieving and now what they are achieving. And if it is reduced, then we have to find out the reason by this basic.
So you mean you want to narrow down your search?
Yes.
Of the actual cause.
Yeah, because there are so many factors which has to be taken into consideration.
Okay, so what would be your next question to them?
Yeah, then next question will be then what happened? Like what previously you were doing and now what you are doing, and is there any sudden change you saw, or you changed some of your technique or some protocol? Or because if something is happening earlier and it's not happening now, so there must be some introduction is there which is not suitable, and that's why this might have happened. So but then we will ask for the history, what they were doing and now what they are doing, and what is the difference.
Okay. So so basically what we are focusing to discuss here is a problem in the regular working lab and not the batch IVF, because batch IVF poses different challenges, and even a single factor can drastically affect the outcome, and many may sometimes result in a catastrophe. So it is altogether different thing, but maybe when we'll discuss all those things, some of the pertinent areas which are common in batch IVF and regular working would be discussed. So my next question is to Dr. Ved Prakash. I mean, what would you like to know from the clinic?
As rightly said by my Dr. Charudat Joshi, that we have to consider so many factors in this, because this is not only one factor depends all the pregnancy rates go down. So we have to check everything. Is that embryologist is following all the SOPs what he was following earlier, and any new instrument, any new equipment they are using, or maybe disposable they are using, any new media, maybe they are using any calibration in equipment they have done recently.
Yeah.
Any type of
you want to know what has happened during this period.
because that it
Also,
means that that particular period they are getting the pregnancy rate
okay.
down, not earlier. So I have to compare both the period. What has happened in last 1 month or maybe 2 months, that pregnancy rate is going down.
Okay, and you put this question, any incidences. So what do you mean by any incidences? Like what?
Maybe incidents like that I mentioned that calibration in equipment has been done.
Okay.
That I want to share my experience. I think it is way back around 15 years back, when one engineer came to my lab and he told me that your CO2 calibration is not okay. So I have to calibrate the things. So he calibrated all the things. And after calibration, what I found that in that particular month, the pregnancy rate was just like a 0.
Oh.
Yeah. So I checked everything, all the things, and I found that nothing has been changed last month. And only suddenly I came to know that that thing I changed is that calibration I have done in that incubator. So in the morning I went there and changed my setting to earlier setting. And after that, I found that my everything is okay. Results are
So
okay.
one thing which, as a laboratory director, I would like to encourage in my junior staff is they report any incidents, whatever something, if something has gone wrong, knowingly or unknowingly. So they should report the incidents and we note those incidences. So this is something which is lacking in our laboratories, especially in India.
Even any disposable you are using,
yes,
you have to report everything because they can affect your result also.
Correct, correct.
Yeah.
Perfect. So the next question is, like you said, similar question has asked, Dr. Rajvi has asked this question, that she wants to know what has changed in this lab over the period. Dr. Rajvi, what information do you want to get from this question?
First and foremost, when you get a drop in pregnancy rates, the factors could be the quality of the gametes itself, which could be the patients. But then if you see a drastic drop, presuming that they have called for troubleshooting, it is a little irrelevant to believe that suddenly you have all the bad patients coming at one kind of time. Second would be the people working, the staff. They play a very crucial role because it's a high skilled job. And it could be just that, there is somebody new who's come in who doesn't have the experience, and the personnel could be creating a problem. Or they have on their own modified the SOPs, they shorten the time of incubation, for example, for ICSI or things like that. Then that could be responsible. The third thing could be your media, if they have changed the source, for example, or maybe the medium has been brought but not stored properly, or something to do with the medium and the disposables. And finally, I would say another most important factor will be the environment, which is all in all not in our control, because the air that is in the culture room finds its way into the incubators also, as well as into your workstation. So even if you're cleaning up the air and somebody's not started the workstation in advance, the air in the room gets into the workstation. So that becomes another crucial factor. And that is something I would say is not totally in our control. So that is the reason one really needs to find out. And in fact, before going to that, I will try to go back and say, you're saying low pregnancy rates, and you find out, yes, the clinical pregnancy rate is low. Then we'll go backwards to see that if you are culturing to blastocysts, what is the blastocyst formation rate? Okay. If the blastocysts are being formed, then you have that something else is there, or the number of cells in the blastocyst, or if we talk about the timing of development, developmental rate. So one has to actually methodically go backwards to see where we start seeing some kind of an indication of something going wrong. And then we can start identifying the potential cause. So perfect. I think, yeah.
So then Dr. Alex asks, related to your questions, is this lab performing the same as before? So as you rightly mentioned, what were the other things that were there? So he wants to know KPIs. Why, Dr. Alex, why these factors are important to you? Dr. Alex?
The foremost thing that the key performance indicators we can say that for a proper troubleshooting or problem solving, you have to go back. You need a real root cause analysis. For all these things, the basic requirement is the proper record keeping and data management. And if it is not there, I think that majority of the centers, I know that with the data or the national registry and everything, it become mandatory. But unfortunately, it is not there. Maybe we can discuss hypothetically about a KPI for the time being. But it is true that the KPI is very important. When you look back, you should see what is a competence level and the laboratory for each factors. Like maybe if it is pregnancy is down, you should check for each one. It is not only the personal KPI for the individuals. That's very important. That also comes under the professional level of KPI, but also you should have a KPI for the equipment. Mm-hmm. Like even recently we had done a temperature mapping of different incubators. Because usually the incubators that you get, if you have your own temperature probe, maybe on particular point you put it and you just see 37 or 36.9, you call the engineer, set it up. But each spot in a benchtop, because now people think that a benchtop incubator is a way forward. But there is also a kind of a thing that you need to be considered, like whether each spot where you keep the dishes are maintaining 37 or 36.9. I think that also very important, because I think we all know we learn a lot of things from Dr. Jason Swine. Like the temperature really causes the mosaicism, and because mitotic errors might happen with temperature variations. So that one of the things that need to be controlled. And you have to see the if it is a center that to do the blastocyst culture, you should see their blastocyst rate. And if it is a day 3 transfers, also you should see what is their day 3 cleavage rate, and all these things need to be monitored. I think then you can see exactly which way it is going forward.
So that means you want to know whether the clinic is maintaining proper record. Yeah. They are doing their internal audit or not of their results?
True.
True. Okay, fine. So then the Vienna consensus clearly mentions what should be one laboratory's like the KPIs and what should be the benchmarks and what should they do to improve their KPIs.
Yeah.
Yes. So we all should be monitoring and analyzing our data regularly. So the next question again comes from Dr. Rajvi, and she asks, what are the other factors that can influence the results? And this question is not to the clinic, but she asks among the experts that what other factors that can be influence and what other things that we should look for. So this question was discussed, and then we discussed that there are things that probably beyond the laboratory and may come in the clinical side. So there are certain clinical factors, and then our extreme panelists, they discuss that there are several issues. Now, Dr. Rajvi, why these factors affect the outcome?
The first thing is the pregnancy, whether it's a live birth or a clinical pregnancy, is an outcome of the fusion of the gametes. And the quality of the gametes plays a very, very crucial role in the development of the embryos and the fetus. So if the gametes are highly compromised, then we cannot, I call it the raw material. So if the raw material is very poor, how can you expect a good product? So it is very, very crucial to have that the gametes are of good quality. Now, of course, we will counter argue that these are infertile patients, so you can't expect the optimal gametes. But supposing if the gametes are extremely poor, then we cannot. For example, if we are having a lot of oocytes from a woman with PCO, so in that cases, we will have the quantity of oocytes is very high, but the quality of the oocytes is highly compromised, and very often they do not lead to fertilization of pregnancies. Or in terms of the say the sperms. Now, if we are doing sperms in severe oligoasthenoteratozoospermia and the sperms are not good, it's also, we may take time to find the sperms. And that time taken will also affect the subsequent embryonic development. Now, add on, we do know that the environment plays a very crucial role in the developmental processes, what we refer to as the epigenetic changes. So how the genes express would be dependent on the environment. And the Alex has already mentioned about the temperature. Again, if you look at the pH and osmolarity, they influence the development of embryos. So for example, if the pH is altered even by a minuscule amount, it causes changes in the genetic expression and the development of embryos. And because of this, and pH changes can happen so swiftly. For example, if you're leaving the dish open for a period of time, the pH changes drastically. And that's the reason we always pre-equilibrate the media for overnight. You know, it's minimum 4 to 5 hours, but we always recommend do it the night before, so you don't have to worry about proper equilibration. Add on, we have oil. Now, in case of oil, what happens is that it is slow, but the pH does get equilibrated. But what happens is that when you're preparing our dishes and we put multiple drops, and then if there is even a minuscule amount of evaporation, because our medium is water-based, and therefore if there is evaporation, osmolarity changes. Now, at least pH, when you put back the dishes in the incubator, can adjust with the CO2, but osmolarity cannot come back. And therefore, they have done studies to show, I think it's Jason Swain himself who's done a lot of studies, and even Kay Elder has shown that as you reduce the size of the droplet, the impact on osmolarity changes is very high, and subsequent embryonic development. And that, to my mind, is, again, if you look at it, it's quite common sense, because smaller the drop, evaporation, the osmotic changes would be much higher. A drop lost from an ocean or a 1 ml dish is nothing. So that again affects embryonic development. And ultimately, if the effect is very bad, then possibly they get blocked very early in the development. Otherwise, they do manage to go to, if they go to blastocyst, then we know that we have better impacts. So I think all these factors play a role. Also, like I said, the skills, all of us have a learning curve. We cannot deny the fact. And that learning curve makes a big difference. For example, you know, we all say vitrification gives 100% recovery. Fine, provided vitrification happens. And there could be, while we are learning vitrification, we believe we are using the process and technique of vitrification, but there is crystallization taking place because we have taken longer. Or while inserting or removing it from the liquid nitrogen can, you know, you have taken time to check out the name or something. There's no vitrification. There's no, the warming, cooling rates are changed. So therefore, the learning curve also has to be taken into consideration. Of course, the disposables and culture media, and to a great extent, I feel that these are now, you know, like Dr. BNC said, what was the struggle earlier, 30 years ago, 40 years ago. Now, of course, these are very well standardized. They go through all the QC controls. So if you're buying them from standard companies, I'm not too worried. But of course, how it reaches you, especially if they're going to the interiors of India, and if they have not been, the culture medium has not been transported correctly, then there may be some concerns with that too. So I think all in all, it's all the factors that come into picture. And finally, you know, we have come down from, there was a time when people did natural cycle. I mean, Louis Brown was born from natural cycle, and Kanupriya was born out of ovarian stimulation. Then we thought number is security number. So we went on a very heavy dose stimulation to get lots of oocytes. And now we've come back to the realization that too many does not mean too good. So we are coming down to minimal stimulation. And so I think all these factors do play a role. So it is always advisable when you're doing such kind of troubleshooting is to identify that zone in which the problems have possibly initiated to find a solution.
Okay, great. So Dr. Alex, what do you think? How important is the ET procedure? As Rajvi clearly mentioned, that we all have a learning curve. Even the clinicians, they need time to learn everything. There are situations when the clinician is changed, or the junior clinicians, they join the team and they are assigned the job to do OPUs or ET procedures. So how do you think, how important it is?
Yeah, that is also very important, because when we talk about the KPI, it is not only the laboratory person's KPI for their ICSI, fertilization, degeneration. The KPI also should involve the clinician, how much maybe the M2 oocytes they get in the per stimulation, and also how is the pregnancy rate if you have multiple clinicians doing the embryo transfers. we should do a kind of auditing of the clinician. How is their pregnancy rate across, versus each embryologist? I think that need to be compiled maybe monthly wise for your board meeting or a negative analysis, and that need to be discussed properly to for a good way forward.
Okay. So sometimes there may be some policy changes, like they were doing regular stimulation with the standard protocols. Then they suddenly changed their protocol and shifted to mostly mild ovarian stimulation, or they suddenly adopted to blastocyst culture or just single embryo transfer. So do you think these things also affect the pregnancy rate?
Yeah, definitely. You have to look from the holistic viewpoint. That is why the recent Cairo consensus mentioned that as the embryo culture system, everything, you have to look at everything. It's not only a particular factor. I think that need to be considered. And we should, when you have this kind of situation happens, you should analyze each and every factor happening, either on the clinical side or in the any policy changes, like maybe from the like you, most of us, you know that the norm was doing the long the agonist protocols, and maybe 10-15 years back people changed to the antagonist protocol. During that time there was a learning curve. You could see many clinics, they are not getting good pregnancy. It took some time to adopt to that change. Similarly, when you do that kind of changes, you should analyze, I think, whether it is affecting your outcome. That is very important.
Yeah, because we often come across this situation when we do the audit and the everything is fine, perfectly all right in the laboratory, and still they have a drop in the pregnancy rate. So sometimes it happens that the clinician who is performing the ET is not proficient in that particular aspect of IVF. And we all know that creating good embryos is crucial, but doing proper ET is even more crucial than the creating embryos. So you perfectly explained all those things. Thank you, Rajvi and Alex. So we
even I sorry
yes, please.
Even that we didn't talk about that patient profiling. So patient profile is also important factor, I think.
Yeah.
Because
So
sometimes sometimes they're poor responder, they are getting 1 or 2, or sometimes AMH is very low. In
yes,
that kind of patients, we are not getting good quality of egg. So it is very difficult to form good embryo from the bad quality of egg.
exactly.
I think it should be take consideration for that patient profiling also.
Perfect. So Dr. Chardat Joshi now asks that if there are any physical change or constructions or paint in the operation theater or ET room, because we always focus on the laboratory, but there might be some other changes in the operation theater or the ET room or in the nearby area. So Dr. Chardat Joshi, what information do you get from this?
See, this is, I feel this is a very basic problem in our country. Like we don't plan ahead of next 15 years how we are going to develop the center and all. So many times it happens that once the center is started and then they do some changes inside by maybe in some construction, maybe making more space or coloring again. And as I observed, many times it happens that during planning an IVF center, new center, they don't even consider the nearby areas and what is the master plan of that area, and in future what constructions are expected nearby. Okay. So considering that there are so many things which can cause reduction in the pregnancy rate, ongoing pregnancy rate. I know few examples when they have just changed the place of their laboratory within the same premises from one floor to another floor, and there is a drastic reduction in pregnancy rate. So it may be because the environment, the culture conditions, the air quality, or n number of factors may be not suitable for the lab in that particular floor. So by this question, we will definitely try to find it out whether they have done any changes in interior of the lab or OT. Maybe they have put some paint or some other construction is some changes in the OT table, orientation of the table, kind of table introduced some new, because we know it's an ongoing development is there in this field also. So daily we come across new things which has to be incorporated. But then before incorporating any new thing in the lab, we have to, lab or OT, we have to see the other factors also involved with it. So this question will answer us that is there any change they have made in as far as the construction or the site or the orientation part is concerned.
Okay, so you mean by getting this information on the construction and paint or etc., you want to establish a connection in the increase of VOC in the OT and ET room and
Yes.
the outcome.
And I would like to give one more example. There is a lab center running very well and doing good number of cases, good pregnancy rate. And then in last year or so, there is a flyover construction started, and it was there in master plan, but it was not considered earlier. And they are facing problem from last 1 year in some way or other because of this construction going on just in front of the center.
Very true.
So,
very true.
So this type of problem can also come across.
Very true. So like we have many publications regarding the VOC and its importance in the IVF outcome, starting from the area and the adjacent industrial areas which can affect, or the traffic and the construction, everything. So as Dr. Alex also mentioned, so we need to dig out all those possible causes. Okay, so now we believe that everything seems okay, everything is perfectly all right as per our question. So should we go back from the OT and ET room to laboratory again? So as the ASRM guidelines says that there should be a staffing and workload ratio. So can this overburden staff really impact outcome, Dr. Alex?
Yes.
That's $1 million question.
Yeah, because everything found perfectly all right as far as the physical, I mean, infrastructure is concerned, as far as SOPs are concerned, everything. But they have just one person to work in their laboratory.
Yeah, many people may not agree that because in our country, it's mostly batch IVF centers and they will tell that everything is going fine. Until we get the data screened, then we'll come to know the actual results. So it's a good thing. You should have, as per the SRM guideline, you should have the proper number of the professionals in the lab to do the particular number of cases. That will be maybe more with the kind of the extra work they have to do. Because we had in our Canadian clinic, we had a Chinese embryologist, and in between, after 1 year, he left our program because the reason is that he couldn't do the paperwork.
Okay.
Because which each kind of work, like you had to do a lot of paperwork. He was telling back in his country, somebody was doing all these things, some administrative people in the lab was doing. So this kind of things maybe get more when the regulations comes in the country. You will have more paperwork, more concern with each and every, starting from the sperm collection to everything. So I think with the more and complex procedures coming into the lab, like the kind of the vitrification, then with the biopsies, I think we should have the ideal number of people in the laboratory, at least the assistants, especially when we have the witnessing, that is mandatory. I think you should have enough people. That should not be taken as lightly.
Yeah, so like recently we had this discussion on another platform, and even Joyce Harper and their group also worked on this, that there is a direct connection with the level of stress in the staff and the outcome. Perfect. So we move on to another guidelines. We talked about the person, that there should be sufficient number of lab personnel. But again, if the number of cycles, let's say, for example, they were doing maybe 10 cycles a month, and now they have grown and they are doing 20 cycles a month. So whether their number of equipment, especially the number of incubators, is sufficient to cater that 100% increase in the workload. Dr. Rajvi.
Yeah, I mean, as he talked about the personnel, because we are human, there are chances of error, there'll be fatigue. Same thing happens with equipment. Now, if you're having limited number of incubators, every time you open it, there is going to be a reduction in the CO2. I mean, so that will again affect the embryos which are there. So the number of incubators becomes very, very crucial. Of course, one aspect is that supposing one of the incubator gets bad, then of course you're stuck. But apart from that, just opening and closing. Today, because of the benchtop, people feel a little more relieved as compared to the box type incubator, because it takes nearly 18 to 20 minutes. Once you have opened the incubator and brought a dish out for just 3 minutes, it takes about 20 to 25 minutes for the CO2 to come back. So that is quite a long period of time for the existing embryos and oocytes to be exposed to say lower CO2, and which in turn would lead to problems with the development. Second thing is that we believe that we are using oil, so we are safer from the fluctuations of pH. Let us remember, oil is not a complete isolation blanket. If it reduces the evaporation or the release of CO2, it also takes much longer for the CO2 from the environment to get back into the through the oil. So that is the reason it is always advisable to have multiple incubators if you have a higher workload, or space your cases up such that you do not have many cases that is done. And I think that is where the batch IVF situation comes in, because if you're going to work in a group, yes, you may have people coming in for a day or two, but then also you need to be equally prepared with that much of equipment to handle the large number of cases or large number of gametes that you would be handling. So incubator becomes very, very crucial in this case.
Yeah, so like stress, it is as important to the human as to the embryos, because yes, we know from the wonderful work of all those great scientists in human physiology, human reproduction physiology, that the stress level can affect the embryo development. They may look nice and morphologically normal, but the stress might have caused some subtle changes or subtle damages to the functionality of the embryos, and the implantation and pregnancy rate may get hampered. So perfectly explained by Dr. Alex and Dr. Rajvi. So this is how we actually built this discussion of today's. It is based on like many factors, but it is very well explained by Professor Kielder and Mark Vandenberg in their book. So what we did is we first focused, as Dr. Charu Joshi explained in his first statement, that is there a problem or not? Then we defined the problem. Then Dr. Alex wanted to know the KPIs and all the data, so we did a little data mining, and what data relates to the problem we collected and analyzed. Then we go back to the problem and focus more specifically that to redefine the problem. So we had a problem, then we redefined it, how specific this problem is. And then we went back to the root cause to identify possible root cause. Then we prioritize our work and our sort of troubleshooting. Then comes the corrective actions. So Dr. Alex, I want to know from you and your experience, so what corrective actions should be taken, or what should be done? Like there is one thing which is lacking obviously in this laboratory that they do not have a QMS system implemented in their lab. Otherwise, they would have known this problem that the pregnancy rate has started coming down. So what would you suggest for the corrective actions?
The first and foremost, I would say that they should have a proper data management for each and every process that they are doing. And they should have, as the Vienna consensus, they should have a KPI, and maybe they should also have a control chart.
Okay.
Like the monthly, how is the variations for fertilization, the pregnancy, and all the outcomes should be charted out. And also they should have a process map for each process that they are doing. Then only you can go back in a troubleshoot situation and analyze this kind of a root cause analysis can be done. So I think that's very important. Like the quality management system should be in place in each laboratory. That is a vital thing. Without that, we are helpless. We can't do anything in the laboratory.
Great, great, great. So this was all what we discussed during the troubleshooting, but here I would like to invite you all to discuss a very wonderful paper from Norbert Gleicher and their group from US. And they monitored that over the period of time, over the years, the live birth rate has started little declining. And this is something which is like we have started developing and advancements in the field of IVF as far as the newer gadgets and other things are concerned, the designing of media and the automation and introduction of AI in the field. But you can very well appreciate the decline in the live birth rate. So they summarize this thing that there are some newly introduced things in the laboratory or in the IVF arena, and these additions might have in fact led to the decline in the live birth rates. So like the extended embryo culture to blastocysts, not every lab is equipped to do this. Same stands true for elective single embryo transfers. And if you are doing this, so maybe sometimes you are left with no embryos to do the transfers, and obviously the things, they go down. The closed embryo incubation system with time-lapse imaging, PGS, mild ovarian stimulation, cycle interruptions like all freeze cycles, which was taken as something very fashionable, and embryo banking with combined frozen thaw cycles. These are some of the things, and their key recommendations are more carefully consider changes to routine IVF practice before clinical implementation, conduct prospectively randomized studies of the effects of recent add-ons to IVF practice and IVF cycle outcome, urgently investigate the effects of industrialization, because this service sector, the IVF, has become an industry over the period of time, and everything, including the patients and other things, have become commodity. So this, I mean, transformation of the service sector of IVF to industrialization has also led to declining of this. This is observed. I mean, this was very much evident in countries like Japan, Australia, New Zealand, and US. So this is something which is alarming, and we should be very, careful in adopting anything which is coming up. So as Dr. Alex mentioned in his explanation during this whole discussion, that everything is important in IVF success, right? And the Cairo consensus guidelines very beautifully describe all those things. So I request on behalf of all participants that all those who are working in the IVF laboratory, be the embryologists, be the clinicians, be the andrologists, be the seminologists or the nurses, everyone should read these things and have their SOPs in place, have their QMS in the place, have the regular discussion among themselves, start formulating their own guidelines, and then monitor whatever the outcome is. Then only they can be consistent in producing the results. So thank you very much, all my participants, all my expert panelists.
Thank you. Thank you so much.
Thank you.
Thank you.
I had a team to give us this opportunity.
Thank you.
Thank you. Bye-bye.